So hello guys, welcome back again to my YouTube channel. So today's section is all about how to solve MCQs. Like first video I told you about the Fmge strategy, and then I told you about Fmge subject wise resources. I covered all the 19. So if you have any if you are stuck in between like how to do this subject, or if you want to get a rough idea how to do every subject, what's the plan or something, you can go back to those videos and see that. And I suggest like see those two videos and come back to this video, because this is a kind of Fmge series, a small help from my side to all my juniors and also those who are going to write the July examination. Best of luck. So let's come back to my this video. So this is about how to solve MCQs. I'm just giving some tips like how to solve the MCQs, because many I received some messages telling like, can I do the MCQs after completing the whole 19 subjects? And I gave them reply like, no. It's because like I always told in those two videos, the previous two videos, like always supplement your subject with MCQ. That means once you complete one subject, like example pathology, after completing that subject, please see the PYQs, both Fmge and NEET PG. And also you can also see section wise questions. If you are a prepladder user, you can see in that subject, particular subject itself. For example, in pathology, if you completed cell injury, the first rapid revision video, after that go to the pathology subject wise question bank and see the cell injury only previous year. That will be having NEET PG, UNICET and Fmge. You can plan like that before completing the subjects and solving the PYQs. You can plan like that also, section wise. So this is the way you should do questions, because the summary is always supplement your first read itself with MCQ, so your brain will be eventually knowing how to solve the MCQs also. And there is an art of solving MCQs also, that is basically we will be getting to know eventually when we practice so many MCQs. And that is the main reason why I told you to see the Fmge flashback PYQ videos of Prepladder app in the YouTube, because that when you will be solving questions with the teachers will be giving you an idea how to rule out options. That is the main thing. So you should see those videos, so you will get an idea how to solve the MCQs. Like when you completed one subject, for example pathology, before seeing the before doing the PYQs of Fmge and NEET PG, see that video once and get to know how to do MCQs. After that, seeing this video, you can solve the Fmge PYQs and NEET PG PYQs even. So let's start saying the tips. So MCQ is something like the answer is in front of you, like a answer is hidden in those 5 options. You just have to pick them. So that is the task. So is even if you don't remember, even if you don't remember something, by seeing those options, your brain will remember it, what it is. So the MCQ is having advantage like that also. And Fmge, there is no negative marking, of course. So the first tip is like, read the question so carefully, very carefully read it, because now there is a problem, like even for me, even for everyone, there is a problem like just seeing the first line, you just jump to the answer. But that is not the way now. Like the problem is the last line of the question changes everything most of the time, because if you just don't read it carefully, just by seeing the first line you are jumping to the answer, you are eventually missing those words, note and accept. So that is a that will be a trauma for you actually. At the end of the exam, you are knowing like you missed the note or accept word, and by your carelessness you just lose 1 mark. Understood? Because 1 mark costs your life in Fmge, because I know personally like 149 is even so that's why just don't miss those words, note and accept. This is something that we can do na, like just being attentive, right? So then long clinical question, almost every faculty is giving this tip actually. The long clinical question, the first tip is like, you just have to see the image first. If there is an image speaks most of the time. By seeing the image itself, and seeing the options. Then first need to see the image and then need to see the options, so we will get an idea like what the examiner want. Understood? So after that, you will be reading the last line of the question, and last line I told most of the time speaks what the examiner want. Then read the full line, because full question. Now you will be asking me like, then why not read the first time itself the whole question? No, because why? It's because like you are attempting around 150 question the first part of the paper. So you will be like, when you will be seeing it, these long questions will come in between. So when you will be getting panic like, array, the timer is first of all going in the side, and also you are reading the whole question, and your brain won't work eventually, like you are reading this much big question. So that's why I'm telling like, first see those image and then see the options. Most of the time image speaks, and if not speaks also, the last line will speak what the examiner want. Then you will get an idea like what is the answer. Actually you will be getting the idea like this is the answer. But for not to have careless mistake, just brushly read the whole question. Understood? So this is the thing. This is where you should approach. And also the buzzwords is something that usually help you to come to the answer. That buzzwords you will be getting to know only by practicing many question. Many in the sense like YouTube discussion video. By that also you will get a bunch of questions. And otherwise also through the, I told, PYQs. By practicing the PYQs of NEET PG and FMG also you will get a bunch of questions. And also the section wise many questions are there in the section wise also in Prepladder. Subject wise, that section of the topic having previous year question. So this is a thing. And also in Telegram, those trusted groups like Damska FMG group, and also mist group, these platforms will post every day some questions. Before your bedtime, just see those questions. You will be doing in Prepladder, I'm taking an example of Prepladder, and you are getting wrong one question. Don't just go to the next question, because the like, we should read the explanation. Just read the explanation now, like only for those who went, that you went wrong, why you went wrong. So that question will be something that you don't know, or it will can be a careless mistake. But reading the explanation will make you understand more about the topics, because always FMG exam is about previous year topics. It's not about PYQs. It's about previous year topics. But while you are doing the previous year questions, you are getting an idea what topics are asked, right? In the first video also I told you this. So if you are making a mistake in previous year question, also in any other question, read the explanation. That will be you will be getting to know like why you went wrong, what is this topic. Understood? And those questions which you are making it again and again wrong, then you are not understanding it. So you read that topic, you write somewhere and read that topic, or make a short note, sticky note, and stick it in walls. Maybe that question will be something which is more important topic. Understood? So don't leave any the wrong questions. That's what I want to say you. The one you went right, in my opinion, no need to read the explanation, because if you made it right, that's something you know, right? Or otherwise, if you made a wild guess, yeah, of course, you just have to read the explanation. Understood? So this is the thing. And yeah, during examination, like my problem also, I think most of the people's problem, it's overthinking. It's because like overthinking and underthinking also is there. And overthinking is like something that we know, but still we will be thinking like why they are asking, like we will be overthinking to too much extent, and eventually we will be making that wrong. That is not needed now. Like something I'm telling, like something that we already studied, some topic previous year topics that already we used to do the based on that topic MCQs, and we are used to get it right, and we know that that is the answer. Or something some questions that we saw in the GTs and mock test, and we know like we made the mistake, and then we know like why that answer came, and we know the answer of that particular topic or the question, and that is appearing for the exam. Your first instinct will be right, like see, by seeing the question, this is the answer. First instinct will be right. Don't overthink it and don't waste time, just go to the next question. And underthinking means like, listen, underthinking here, the uh, art of ruling out comes actually. That is, if you are if you are knowing, if you are reading the question and seeing the options, it seems so confused. In that time you should be having the art of ruling out, like, okay, option A cannot be, okay, option B cannot be, and you are stuck in C or D, and okay, this can be, and that also can be. Then read the um, question again and rule out and come to an answer. It can be right, understood. So this art you should also use for those you don't know, the questions you don't know, like, don't know matlab, like, you didn't see and it seems so confused. By ruling out options you can come to the answer. And also, if there is a picture, see the picture also. And if you see the if you are, like I told, like, first see the picture then see the option, still you are not getting an idea, by ruling out and then seeing the picture, maybe this will help, understood. So this is like art of ruling out. That is coming eventually by practicing so many questions. And another thing is, like, don't be anxious while solving the questions, because during examination time also you will be feeling so anxious, like, we this is something which decides the future, right? So we will be feeling anxious, but we should be so cool. And the last day you should be having a good sleep. And majority seniors used to tell us, even me, but I studied morning. But the thing is, like, don't study, like, be so cool and just read your sticky notes. Like, in the examination day you should be very much cool, and you should be, I mean, you should be having a mental state like everything is gonna be right. Next thing is, like, about solving FMG solutions. FMG solutions mainly, like, mainly practice the colored pages of the FMG solutions. Colored pages, matlab, those are the most recent questions. And then also practice, yeah, of course, practice the image based questions, and also practice those questions where they mentioned in the bracket recent paper. I will show you this, okay? I will show you. Like, while revising the subject, I'm telling you this. Like, this is a tip, okay? Like, while revising the subject, I'm telling you guys, see the image-based questions. How, matlab, I'm telling, like, once you will be doing your first read, after that, I told you to do the PYQs also, the section-wise questions, right? So you will be coming across the image based questions inside the PYQs itself. Bookmark that. So that will be a kind of a different MCQ section for you, images only for that subject, right? So when you will be revising that particular subjects after the first read, the first revision I'm just talking about, when we will be revising that particular subject, you will be revising again your PYQs also. This is needed. And that time the wrong questions, it's again there will be, and the wrong ones you made, revise that, the explanations, and just brush up with the right questions also. And also you should uh, you should revise the ones bookmarked images also. You will be revising that too. So that will be you every time when you will be revising the bookmarked images also, you are revising. So images are eventually getting to your subconscious mind. So that is my tip, okay? Bookmarking the images. And of course PSM is something that is having images only, the logos of programs, everything. So that I am telling you, every time when you revise, please see the imageathon video of Neha ma'am. I showed you, right? Imageathon video of Neha ma'am. And also in the last days of your exam, you will be seeing, not seeing the video again. Like, every time you are revising the PSM, you are seeing the imageathon video of Neha ma'am. But the last days of your exam, you will be revising the PDF of that. Okay, like brushing up through the images. Understood. And also microbiome and pathology is also having images that will be helping you to solve those questions easily also. Micro and patho. That also in the LRR of Preeti ma'am is many images are covered, and also in the RR notes you will be seeing images. That you will be doing, I know. I told you, it's not about by hearting the options, it's all about studying the PYTs. And that you will be getting to know only by practicing so MCQs. So again, I'm telling, whichever source you are studying, every time I'm telling, because still I'm receiving comments like offline or online, which is better. Whichever source you are studying, just stick on to that. Understood? Even if it's offline, even if it's online, everything is so perfect. So just study and stick on to that. Okay, like trust blindly that particular source. And another thing is, like I told you, it's all about consistency and determination, which is more needed in the online section, because nobody is there to pull you, I mean push you. Nobody is there to make a timetable for you. You should make yourself. So that is the only difference that I felt. And the next is, like, let's solve some MCQs with me, according to my tips. So we will be getting implement those tips while practicing MCQs. Okay, let's solve some MCQs with me. Start. The first question, it's like, see this question, the last line is written. Let's read the last line. It's written, upon further investigation a lung biopsy is performed and the microscopic examination revealed asteroid bodies. So asteroid bodies they are talking about. So according to our pathology knowledge, we can apply. The options are sarcoidosis, rheumatoid arthritis, Sjogren's syndrome, and SLE. We know in sarcoidosis we will see these asteroid bodies, na? In rheumatoid arthritis we won't see, and Sjogren's syndrome, the buzzword is like dry eyes and dry mouth. And now read the question now. Before marking sarcoidosis, just confirm and correlate with what they gave other data. It's written some complaints of respiratory discomfort, shortness of breath, and past few weeks. So they are talking about most commonly the lungs are getting affected. So sarcoidosis, most commonly lungs will get affected, and asteroid bodies they are written in the last line. So by reading the last line in long question, we can jump to an answer and just correlate with the other data provided. Next question, it's like this question, see the last word is written, what is the most common thyroid cancer? So just by what is the most common, we know it's papillary carcinoma. So papillary carcinoma should be the answer. Even if the other things by reading the first lines and everything, even if you can't understand what they are talking about, just by the last line we can understand, like it's talking about papillary carcinoma, which is the most common thyroid cancer. And now I will give you a big question. See this is a very big question, but in the last line is written, stool examination revealed the presence of trophocyte and cyst. Both are infective stage. Characteristics of falling leaf motility. So falling leaf motility, we know, like in my microbio, Dr. Preeti Sharma ma'am have told, falling leaf motility is seen in Giardia glamblia only. See the other option, Salmonella, Entomoeba histolytica, Cryptosporidium, known, right? And now correlate with the other data, it's written frequent diarrhea, abdominal cramps, bloating, and weight loss. So small intestine duodenum is affected in the Giardia lamblia. So we get to know, like falling leaf motility, Giardia lamblia only. Now see this question, this I made wrong. A patient present with seizures is CT head revealed multiple parenchymal cysts. Which of the following is correct? So see, I made wrong, I marked B. But I will not jump to the next question. I told you guys to read the explanation. So we will read the solution, read the explanation, we will understand it, then we will be doing the next question, right? Now see this question. By just seeing the image, we are seeing keratin pearls, and we know keratin pearls is seen in what? So we understood, like we are they are talking about something related to keratin pearls. So by seeing the options, we understood, like they are talking about tumor markers. So we know keratin pearls, P for P, it will be P wala markers. Preeti ma'am told keratin pearls are seen in squamous cell carcinoma, and she told, like keratin pearls, P for P wala markers will be. So there is only one P wala marker, is P40. And in the question, see smoker related lung cancers are squamous cell and small cell carcinoma. So Preeti ma'am told, Dr. Preeti ma'am told, small cell carcinoma mein in wala markers, something in sound should be there at the end. So, and adenocarcinoma is nothing related to smoking wala history. So adenocarcinoma, A for A, she told, A wala markers, and also A is the first alphabet, so something 1 1 will be written. So A, B, C is related to adenocarcinoma markers, so P for 40 will be there. Keratin pearls is also seen in squamous cell carcinoma, and P wala markers will be there in squamous cell carcinoma. And next, this question, see, this is an ENT question, 60-year-old diabetic. So adult patient diabetic, it's
only malignant otitis externa it will be, and other diabetes mellitus, pain, discharge, granulation, facial palsy, the diagnosis will be malignant otitis externa. This is the tip of buzzwords that you will be getting to know by doing so many MCQs.
Vaishnavi ma'am have explained amazingly in her last road revision video how to use buzzwords for ENT and solve the MCQs. Also in her FMG flashback series. So that will be a cakewalk for you. So that you just have to see those videos after. One guy told me yesterday, like, can I see the videos and then solve the MCQs instead of rapid revision? No. After knowing your syllabus, for the exam, reading the seeing the videos of rapid revision, after that reading the notes of rapid revision, then during the your first revision is the one you should see those videos and concise, understood? Like then your subconscious mind will eventually say like, okay, I read this. When you will be reading again your rapid revision notes and seeing those videos in the first revision, and of course you will be doing the PYQs in the first read itself, and doing so many MCQs, you will be getting to know, you will be getting an idea, understood? So FMG solutions I told now. So FMG solution, see, this is a colored pages of anatomy. All these are most recent questions, you should do it. And also see the next page, also in the every section you should see, you should go to the next page and see like anything is written most recent. Those questions are also important, okay? And also IBQs in the FMG solutions also you need to see. So that's it. I am thinking like this will be a helpful video for you how to solve MCQs. Of course, you guys all will be having your own tips, your own ideas, which will be very much perfect. So this is a video where for people who, I mean, are very much tensed about solving MCQs, having anxious, just to for them how to solve the MCQs, an idea, a tips, understood, and how to solve long stem questions. Just a small help from my side. This whole FMG series is just a small help from my side, and I wish all the best for you. And some of my help is um, you are getting benefited with. I am so glad. Thank you so much. Thank you so much, and for all the love. Also, best of luck. I am always praying for you, all of you guys. Best of luck. Bye.